we, we experience deaths all day long. I mean, you go, just little deaths all day long. We look in the mirror, you see an extra line or gray hair, or you go to get the bus and the bus had broken down, or you get up and it's ice on the ground. So you go through changes and deaths of expectations all day, every age. And it appears that where you put your heart is what you get out of life and death.
I'm a Dr. Chen. I'm an anesthesiologist working in the Brick Hospital. It's an Ocean Medical Center, Department of Anesthesiology.
My name is Nina Angela McKissick, and I've been a hospice nurse for 14 years, but I've been a nurse for 36 years.
For the medical knowledge, the death usually is the brain die. That means the brain is not functioning anymore.
The whole thing with hospice is freedom from suffering emotionally and physically. You help someone, you have a feeling of satisfaction. When you serve someone, you have a feeling of gratitude. I mean, the dying are real good bullshit detectors. You go in there and say, oh, what doesn't kill you makes you stronger, or you can become stronger from this. They just want to take and smack you and say, listen, I was strong. My marriage was beautiful before this. This is friggin' tearing us apart.
The family usually, some family will cry. Sometimes some family members that don't even have. You look at them, they don't have any emotion reaction. Actually, they feel very sad. So we will talk with them directly, give them chance to cry, and ask them what they need. And if they really have a psycho reaction, that some family maybe even says they want to suicide. So we can, with a psychologist to help. And some family members need a treatment.
You take your pain into the patient's experience, and you try to get, and you don't try, but perhaps you can get a little bit closer to their pain without judging it.
The job of the patient die or not usually is the chief physician. When we do resuscitation, we make sure if we cannot resuscitate patient, the doctor's job is declare the patient has died. So we have documentation, what time is died, and what kind of problems. For some patients, is end of stage of disease like renal failure or end of stage of the cancer, and we know that dying sooner. So we usually the upset will be much less. But for some patient, it suddenly happen, and maybe some history is hidden, so we don't know exactly what's happened. Sometimes the doctor will feel very upset. They think some problems, maybe they miss something. And if the patient will die, sometimes we do feel guilty and feel maybe we didn't do the best job for the patient. Sometimes, yeah, depends on the situation.
When you realize that we're all in this together, and that no one escapes it, and that it happens every day, then the transition could be a lot more peaceful. And all the great books actually tell you to keep death close by, because then you will enjoy the preciousness of life so much. The ability to swallow, the ability to blink your eyes and have tears, the ability to sit up and have our bodies support us while we're seating. I mean, the ability to have saliva. I mean, I have patients, who can no longer swallow because they can't produce it. I mean, just those dear things, not to be feared, but have it as an old friend that's been with everyone, and invite it into the room, and let's sit down, get to know you, so I'm not so afraid of you.